Welcome back, everyone. We're diving into some fascinating territory today. I've got these notes from a nursing student all about peripheral vascular systems.
That's pretty specific.
It is, but you know what? This stuff applies to all of us, even if we don't wear scrubs to work. We're talking about the network of blood vessels that literally keeps our bodies going.
Okay, I'm intrigued. Arteries, veins, all that good stuff.
Exactly. And the lymph vessels, too. They don't always get the spotlight they deserve.
They're kind of the unsung heroes, aren't they? Quietly doing their job in the background.
So true. But before we get ahead of ourselves, let's break down the basics. Arteries, veins, how do they work together?
Well, think of arteries like the high-pressure expressway of your circulatory system.
Carrying that oxygen-rich blood from the heart.
Right. To every nook and cranny of your body. And then you've got the veins.
Bringing that blood back to the heart for a recharge.
Exactly. And the veins are like the scenic route. A little slower, lower pressure.
And then there are those lymph vessels, working behind the scenes, keeping everything balanced.
They're crucial for fluid balance, fighting off those nasty infections, even absorbing fats from our diet.
It's all connected, isn't it? This complex network keeps everything humming along. But what happens when there's a roadblock in the system? Let's talk about peripheral arterial disease, or PA,
PAD is often called a silent disease.
because it can sneak up on you.
Exactly. Many people don't even realize they have it until there's a significant blockage.
Is that mostly an age thing?
Not necessarily. Atherosclerosis is the main culprit. That's the buildup of plaque in the arteries.
Like those clogged pipes we talked about last time.
The perfect analogy. And while age is a factor, the good news is there are lots of things we can control to lower our risk.
So it's not just about getting older, it's about the choices we make along the way.
Exactly. We're talking about modifiable risk factors. Smoking, diabetes, high blood pressure, high cholesterol. Even obesity and stress can contribute.
So many things we can actually do something about.
Exactly. And small changes can make a huge difference over time. It's empowering.
Speaking of things we can be aware of, the notes talk about the 6 Ps of P.
I've heard of that. Isn't that a way to remember the symptoms?
Right. It stands for pain, pallor, pulselessness, paresthesia, paralysis, and poikilothermia.
Okay, that's a mouthful.
It is, but it highlights how PAD often has subtle symptoms. Easy to miss.
Until it becomes a bigger problem. Can you break down a few of those Ps?
Sure, like pain, for example. Someone with PAD might experience leg pain or cramping when they walk. That eases up when they rest.
Ah, because those muscles aren't getting enough oxygen.
Exactly. And pallor. That just means the skin looks pale, even a little bluish maybe, because of the restricted blood flow.
Makes sense. What about paresthesia?
That one describes that tingling or numbness feeling, a sign the nerves are being affected.
So if you start noticing any of these signs, what should you do?
Get it checked out. Early detection is key. There are tests that can assess blood flow in your legs.
The sooner you catch it, the better the chances of managing it effectively.
What does managing PAD look like?
It can range from lifestyle changes to medication to even surgical interventions.
Can we talk about those surgical interventions? What are they actually doing in there?
Imagine a plumber working on clogged pipes. Angioplasty, for example. It's like using a tiny balloon to open a blocked artery.
Like a plumber using a snake to clear a blockage.
Exactly. And bypass surgery is like creating a detour around the blockage.
Rerouting the pipes.
And then there's endarterectomy. That's like removing that stubborn clog, surgically removing the plaque buildup.
I'm always amazed at how they can work on those tiny vessels. And the notes also talk about the crucial role of nurses in monitoring patients after these procedures.
Absolutely. They're checking pulses, looking at skin color and temperature, making sure those tissues are getting enough oxygen.
Okay, so we've covered PA, but there are other conditions that can affect the peripheral arteries. The notes mention Berger's disease and Raynaud's phenomenon.
Berger's disease is really interesting. It's a chronic inflammatory condition that often affects younger men who smoke.
Really? Younger men?
Yeah, and it's thought to be triggered by bacteria. From the mouth, believe it or not. They somehow travel and impact blood vessels in the limbs.
Wow. It really shows how interconnected everything is.
Right. And then you have Raynaud's phenomenon, more common in women.
I think I've heard of that one. Isn't that where your fingers and toes turn white or blue?
Exactly.
Yeah.
It's caused by spasms in the small arteries, triggered by cold, stress, even things like caffeine or tobacco.
So even seemingly unrelated things can affect these intricate systems.
Absolutely. And speaking of systems, let's shift our focus to the aorta, the main artery carrying blood from the heart.
The big kahuna.
Exactly. And the notes dive into aortic aneurysms, which can be pretty serious.
An aneurysm is like a weak spot in the aorta that bulges out, right?
Right. Imagine a weak spot in a garden hose. The constant pressure of the water can cause that spot to balloon outwards.
And that can happen in different parts of the aorta.
Yes, in the aortic arch, the thoracic aorta, and the abdominal aorta, they can be shaped differently too. Fusiform, which is like a symmetrical balloon, or saccular, which is more like a little pouch sticking out to the side.
So what causes these weak spots to develop in the first place?
Lots of things. Age is a big one. As we get older, our arteries naturally lose some of their elasticity.
Things start to wear out a bit.
Right. And atherosclerosis, that plaque buildup we talked about, can also weaken the artery walls. Plus, inflammation, infections, and even genetics play a role.
So who's most at risk for these aneurysms?
Age is a major factor, especially people over 65. Men are more prone than women. Smoking, high cholesterol, and a family history of aneurysms also increase your risk.
The scary thing is that I've heard many aortic aneurysms don't cause symptoms until they rupture.
That's right. Many are silent. They grow slowly without any noticeable discomfort. That's why regular checkups are so important, especially for those with risk factors.
So how do you detect these silent threats?
There are a few ways: chest x-rays, CT scans, ultrasounds, and angiography. That one involves injecting dye to see the blood vessels on an x-ray.
And if an aneurysm is found, what happens next?
It depends on the size and the risk of it rupturing. For smaller ones, watchful waiting might be enough, lifestyle changes, medication to control blood pressure and cholesterol. But for larger aneurysms, surgery is often recommended.
Let's talk surgery. What are the options?
There are two main approaches: open repair and endovascular repair.
Okay, break those down for me.
Open repair is a bigger deal, a larger incision replacing the weak section with a graft. Endovascular repair is less invasive. It's like reinforcing the weak spot from the inside.
I'm always amazed by what they can do these days. And what about recovery?
Nurses play a huge role. Monitoring for bleeding, managing pain, watching for complications. It's a team effort to help the patient recover.
Speaking of serious conditions, the notes also cover aortic dissection, a tear in the inner layer of the aorta.
Yes, and it's a big deal. Blood can start flowing between the layers of the aorta, putting immense pressure on it and potentially causing a rupture.
So not something you want to mess around with. What are the symptoms like?
Usually sudden, severe chest pain, often described as a tearing or ripping sensation. But symptoms can vary, especially in older adults or those with neurological conditions.
What are the risk factors for aortic dissection?
Many overlap with those for aneurysms: older age, being male, family history, connective tissue disorders, uncontrolled hypertension, even things like smoking, high cholesterol, and illicit drug use. Pregnancy and a history of heart surgery can also increase the risk.
So if someone experiences those symptoms, it's a 9/11 situation.
Absolutely. Aortic dissection is a serious medical emergency. One of the most dangerous complications is cardiac tamponade.
Cardiac tamponade, that sounds ominous.
It is. It's when blood leaks into the pericardium, the sac surrounding the heart. This puts pressure on the heart, making it harder for it to pump blood effectively. It's a life-threatening situation.
How do you know if someone has cardiac tamponade?
Low blood pressure is a red flag. Muffled heart sounds, distended neck veins, and a narrowed pulse pressure. There's also something called pulsus paradoxus, where blood pressure drops abnormally when you inhale.
So how do you treat an aortic dissection?
It depends on the type and severity. Type A dissections, those affecting the ascending aorta and arch, are surgical emergencies. The tear needs to be repaired immediately. Type B dissections, affecting the descending aorta, might be managed with blood pressure and pain control, and potentially a procedure called TEVAR. It's similar to the endovascular repair we talked about for aneurysms.
So much depends on where the tear is and how severe it is.
Exactly. And before surgery, the focus is on managing blood pressure, reducing stress, and controlling pain. Close monitoring is essential.
Making sure everything is stable.
Right. And clear communication with the patient and their family is vital.
Okay, we've talked a lot about arteries, but venous disorders can be just as serious, right?
Absolutely. There's phlebitis, which is inflammation of a vein, often caused by an IV.
Ah, so that's what that is.
It's usually not serious and resolves on its own. But then there's venous thromboembolism, or VTE, which involves blood clots.
And those can be dangerous.
VTE includes both superficial thrombosis, which affects veins near the surface, and deep vein thrombosis, or DVT. That's when the clot forms in the deeper veins, usually in the legs.
And DVT is the one that can cause a pulmonary embolism, right?
That's right. If a clot breaks free from a deep vein, it can travel to the lungs and block blood flow. which can be life-threatening.
Scary stuff. So understanding how these clots form is crucial.
The notes explain it using Virchow's triad. It's not just one thing, it's a combination of factors.
Okay, I'm listening.
First, you have venous stasis, which means slow blood flow. Think long plane rides or being immobile after surgery. Then there's endothelial damage, an injury to the lining of the blood vessel. And lastly, hypercoagulability. That means your blood is more likely to clot, often due to genetics or certain medical conditions.
Wow, so it's like a perfect storm for clot formation. What are some other risk factors for DVT?
Immobility is a big one, especially after surgery or prolonged bed rest. But also things like a genetic predisposition to clotting, trauma to the veins, pregnancy, obesity, even things like oral contraceptives can increase your risk.
So if you have any of those risk factors, what should you be looking out for?
The classic signs are swelling in one leg, redness, warmth, and pain, often in the calf. Sometimes a low-grade fever too.
So if you notice any of those, get it checked out.
Especially if you have any of the risk factors we discussed. Doctors use ultrasound to look for clots, and there's a blood test called the D-dimer test that can be helpful too.
And if a DVT is confirmed, what are the treatment options?
The main goals are to stop the clot from growing, to keep it from breaking off, and ideally to dissolve it. There's a whole approach that includes preventive measures, medications, and in some cases, surgery.
Prevention is always the best medicine, right? So what can people do to lower their risk of DVT?
Avoid staying still for too long. If you're on a long flight or car ride, get up and move around. If you've had surgery, start walking as soon as your doctor says it's okay.
Get that blood flowing.
Exactly.
Yeah.
Compression stockings can also help.
Yeah.
They improve blood flow in the legs. And there are devices that provide intermittent pneumatic compression. It's like a massage for your legs to keep the blood moving.
Now, what about medications?
Anticoagulants are the go-to for treating DVT. They prevent clots from forming or growing.
Blood thinners, right?
Exactly. There are several different types, but they all work by thinning the blood.
Mm-hmm.
So it's important to be aware of the potential side effects, like bleeding.
So it's a delicate balance, preventing clots, but also managing the risk of bleeding.
Right. And in more severe cases, thrombolytic therapy might be used. That involves medications to dissolve the clot.
Clotbusters.
Exactly. But those carry a higher risk of bleeding, so they're usually reserved for more serious cases.
Okay, so medications are one approach. What about surgical options?
There are a few. An IVC filter is a small device inserted into a large vein that returns blood to the heart from the lower body. It's like a safety net, catching clots before they reach the lungs. And there's percutaneous angioplasty and stenting, which we talked about for arteries. It can also be used to open up narrowed veins. And in some cases, a thrombectomy. They actually remove the clot.
Wow. So many different tools in the toolbox.
It's amazing what they can do. And of course, nursing care is vital in managing DVT.
What are the nurses focused on?
Monitoring for any signs of bleeding, since many of the medications thin the blood. They're also checking to make sure blood is flowing properly to the affected limb. And educating the patient about the condition, its treatment, and how important it is to stick to the plan.
So it's about empowering patients to be active participants in their own care. Now, I know DVT is closely linked to pulmonary embolism, or PE. What's the deal with that?
PE happens when a blood clot, often from a DVT in the legs, travels to the lungs and gets stuck in one of the pulmonary arteries, the blood vessels that carry blood from the heart to the lungs.
So it's a traveling clot, essentially.
Exactly. And it blocks blood flow to a portion of the lung, which can be very serious.
What are the signs someone might have a PE?
The classic signs are shortness of breath, chest pain, and coughing up blood. But the severity of symptoms can vary a lot.
So some people might not even know they have one.
A small PE might not cause any symptoms at all, but a larger one can lead to severe problems. And a massive PE can cause shock and even sudden death. Early detection and treatment are crucial.
Given how serious this is, what are the potential complications of a PE?
It can lead to pulmonary infarction, which is when lung tissue dies because it's not getting enough blood. It can also cause pulmonary hypertension, high blood pressure in the pulmonary arteries. And sometimes fluid builds up between the lungs and the chest wall. That's called a pleural effusion.
So are the risk factors for PE the same as for DVT?
Many of them overlap. Immobility, recent surgery, a history of DVT, cancer, clotting disorders, heart problems. Things like obesity, oral contraceptives, hormone therapy, smoking, and even pregnancy can all increase your risk.
It sounds like anything that can damage blood vessels or make your blood more likely to clot.
Exactly. And how do they diagnose a PE? Well, there's the spiral CT scan, which uses X-rays to create detailed images of the lungs. The D-dimer test, which we talked about earlier, can be helpful too. And sometimes a VQ scan. It looks at ventilation, the airflow and perfusion, the blood flow in the lungs, looking for any mismatches that could indicate a PE.
So what happens if they find a PE? How do they treat it?
The goal is to prevent new clots, dissolve the existing ones, and make sure the lungs are getting enough oxygen. Treatments include supplemental oxygen, medication, and sometimes surgery.
Tell me more about those treatments.
Supplemental oxygen is often given through a nasal cannula or mask. If someone is having a really hard time breathing, they might need mechanical ventilation. That's when a machine helps them breathe. Anticoagulants, those same medications used for DVT, are given to prevent further clotting. And sometimes, in certain cases, they might use fibrinolytic medications, sometimes called clot busters. They dissolve existing clots.
I've heard of those. They sound pretty intense.
They are. They can be very effective, but they also carry a higher risk of bleeding.
So it's a judgment call, weighing the risks and benefits.
Right. And in some cases, surgery might be necessary. Embolectomy is one option. That's when they surgically remove the clot from the pulmonary artery. And IVC filter placement, like we talked about earlier, can help catch clots before they reach the lungs.
So many different approaches. And what about the role of nurses in all of this?
They're essential. They closely monitor vital signs, especially breathing rate, heart rate, and blood pressure. They're listening to the lungs, making sure the patient is breathing okay, and they provide emotional support and education, explaining the medications and what to expect during recovery.
That emotional support must make a big difference.
It does. Having a PE can be a very scary experience.
Okay, so we've covered a lot of ground here. We've talked about phlebitis, DVT, and PE. Are there any other venous disorders we need to know about?
Yes. The notes also cover chronic venous insufficiency.
What is that exactly?
It's a condition where the valves in the veins, those little flaps that are supposed to keep blood flowing in one direction back to the heart, become damaged or weak. So blood starts to flow backward and pool in the legs, increasing the pressure and causing fluid and red blood cells to leak into the surrounding tissues.
So instead of flowing nicely back to the heart, the blood is kind of hanging out in the legs.
Exactly. And that causes problems.
Like what?
Swelling in the legs, for one, usually worse in the evening. The skin can become discolored, taking on a brownish hue, and it might feel thick, hard, even leathery. People with chronic venous insufficiency often complain of itchy skin. And they're also prone to developing venous ulcers. Those are slow-healing sores, usually on the lower legs.
It sounds like chronic venous insufficiency can really impact your quality of life.
It can. And it's important to distinguish it from PA, because the symptoms can be similar.
So how do you tell them apart?
Well, remember how we talked about the skin in PA, often looking thin, shiny, and taut, and the legs feeling cool to the touch. With chronic venous insufficiency, it's the opposite. The skin can become thick, hardened, even leathery, because of the ongoing inflammation and fluid buildup. And the legs might feel warm because of all that blood pooling there.
So those little details can make a big difference in diagnosis. What about treatment? How do they manage chronic venous insufficiency?
The focus is on improving blood flow in the legs, reducing the swelling, and promoting healing if there are ulcers. Compression therapy is really important.
Like those compression stockings we talked about earlier.
Exactly. They make a huge difference in reducing swelling and promoting healing.
So it's like giving those tired veins a little extra support.
Exactly. And for venous ulcers, good wound care is essential. Keeping the wound clean and moist, using the right dressings, sometimes even applying compression to the area.
So it's a combination of proper care and lifestyle changes. What are some lifestyle recommendations for people with chronic venous insufficiency?
Avoid standing or sitting for long periods. Elevate your legs whenever you can. Maintaining a healthy weight can also help. And regular exercise, even something as simple as walking, is great for improving circulation and overall leg health.
So we've talked about exercise and compression. Are there any smaller everyday habits that can make a difference for vascular health?
Absolutely. Foot care is a big one, often overlooked, but it's so important, especially for those with PAD and chronic venous insufficiency.
It makes sense. If blood flow is already an issue, a small cut or sore on the foot could turn into a major problem.
Right. The notes stress the importance of checking your feet every day. Look for any cuts, sores, blisters, changes in color or temperature. Wash your feet daily with mild soap and warm water. Dry them thoroughly, especially between the toes, and moisturize them to prevent cracking.
Good advice for everyone. Taking care of our feet is so important. Anything else?
Don't walk barefoot, especially if you have neuropathy, nerve damage that can reduce sensation in your feet. Wear comfortable, well-fitting shoes that protect your feet. And if you notice any problems, no matter how small, talk to your doctor.
Better safe than sorry.
Exactly.
Well, we've really explored the world of the peripheral vascular system today. It's been a fascinating journey.
It really has. We've covered so much, from the basic functions of arteries, veins, and lymph vessels to all the different conditions that can affect them.
Our circulatory system is pretty incredible when you think about it. This intricate network working tirelessly behind the scenes to keep us going.
I know, and we often take it for granted until something goes wrong.
That's so true.
I hope our listeners are walking away with a new appreciation for this amazing system and how important it is to take care of it.
Absolutely. Before we wrap up, any final thoughts for our listeners? Anything you really want them to remember?
I think the key takeaway is that our vascular health is deeply connected to our overall health and well-being. The choices we make every day, what we eat, how active we are, whether we smoke, they all had a huge impact on our blood vessels. And knowing the signs and symptoms of vascular problems can be life-saving.
Early detection is key.
Yeah, exactly. It's about being proactive,
Yeah,
taking control of your vascular health.
love that. Now, as we wrap up, I'd like to leave our listener with a little something to think about, a question to ponder.
I love it. What are you thinking?
Okay, so knowing what you now know about the importance of vascular health, what's one small change you can make in your daily life to keep your circulatory system happy and healthy?
It really could be anything. Maybe parking a little farther away from the store entrance so you get a few extra steps in.
I like that. Little things add up.
They really do. Now, the notes also touch on varicose veins and chronic venous insufficiency. Those bulging, twisted veins you sometimes see, especially in the legs, those are varicose veins.
I've seen those.
They happen when the valves in the veins, those little flaps that keep blood flowing in one direction, weaken.
Ah, so the blood can flow backward.
Exactly. And that causes the veins to enlarge.
I used to think varicose veins were just a cosmetic thing. But now that I know more about the circulatory system,
You realize it's more than just appearances.
right, it's a sign that something isn't working quite right.
Exactly. While varicose veins aren't usually dangerous, they can cause discomfort, aching, heaviness in the legs.
So they're worth addressing.
Absolutely. Compression stockings can often help. And there are minimally invasive procedures to remove or close off the affected veins.
So if they're bothering you, it's worth getting checked out.
Definitely. Now, it's important to distinguish varicose veins from chronic venous insufficiency, which is a more serious progression of the condition. Basically, the backflow of blood and increased pressure in the veins can lead to bigger problems.
Like those venous ulcers we talked about earlier.
Right. Swelling, skin discoloration. It's not something you want to ignore.
Okay, so how do you know if you have chronic venous insufficiency versus PAD? Their symptoms seem similar.
Well, remember we talked about the skin with PA. It often looks thin, shiny, and tight. And the legs feel cool.
Right.
With chronic venous insufficiency, it's the opposite. The skin can get thick, hardened, almost leathery because of the constant inflammation and fluid buildup. And the legs might feel warm because of all the blood pooling there.
Interesting. So those subtle differences can point to very different problems.
You really can. And when it comes to treating chronic venous insufficiency, compression therapy is key. Just like with varicose veins, those graduated compression stockings can make a big difference.
Helping to push that fluid back up towards the heart.
Exactly. And if there are venous ulcers, meticulous wound care is essential.
Keeping them clean, using the right dressings.
Right. And sometimes applying compression to the area can help with healing.
So it's a multi-pronged approach. What about lifestyle? Are there things people can do to help themselves?
Avoiding prolonged standing or sitting is a big one. Elevating your legs whenever you get a chance. Maintaining a healthy weight can also help. And regular exercise. Even just walking, it improves circulation, strengthens leg muscles. It can make a big difference.
Okay, so we've talked about exercise and compression. Are there any smaller everyday habits that can have an impact on vascular health?
Oh, absolutely. Foot care. It's often overlooked, but it's so important, especially if you have PAD or chronic venous insufficiency.
Makes sense. If circulation is already a problem, even a little cut could become a big deal.
Right. The notes emphasize daily foot inspections, looking for any cuts, sores, blisters, changes in color, washing your feet every day with mild soap and warm water, drying them thoroughly, especially between the toes, and moisturizing to prevent cracking.
Great advice for everyone. Our feet work hard for us. We need to take care of them.
I agree. And don't walk barefoot, especially if you have neuropathy, which is nerve damage that can reduce sensation in your feet. Wear comfortable shoes that protect your feet. And if you notice any problems, don't wait. Talk to your doctor.
It's amazing how these small things can make a difference.
They really can. Prevention is key.
We've covered a lot of ground today.
We have. It's been quite a deep dive into the world of the peripheral vascular system, all those arteries, veins, lymph vessels, and all the things that can go wrong, but also what we can do to keep things running smoothly.
Our bodies are incredible machines, aren't they?
They really are. And so often we take our circulatory system for granted until something goes wrong.
That's the truth. Hopefully our listeners are walking away with a new appreciation for this amazing system and for all the things they can do to keep it healthy.
I hope so too. It's been a fascinating deep dive.
It has. Before we wrap things up, any final thoughts you want to leave our listeners with?
I think the most important thing to remember is that our vascular health is so closely tied to our overall health. What we eat, how much we move, whether we smoke, all of that has a huge impact on our blood vessels.
Those all connected.
Exactly. And knowing the signs and symptoms of vascular problems can be life-saving. So pay attention to your body.
Great advice. Now, as we wrap up this part of our deep dive, I'd like to leave our listeners with a question to think about, something to really ponder as they go about their day.
Ooh, I like where this is going.
Okay, here it is. We've talked about recognizing symptoms, managing risk factors, seeking early treatment. But what about the bigger picture? How can we as individuals be advocates for better awareness and prevention when it comes to vascular health? How can we spread the word and encourage others to prioritize their circulatory health?
That's such a great question. It really makes you think about the impact we can have beyond just ourselves.
Right. It's not just about individual choices. It's about advocating for change on a larger scale.
Exactly. Like, sharing what we've learned today with our friends and family, talking about healthy habits with our colleagues, maybe even supporting organizations that are working to raise awareness about vascular disease.
I love those ideas. Even small things like reminding someone to get their blood pressure checked or to take a walking break during the day, they can make a difference.
Absolutely. It's about normalizing these conversations, right? Making vascular health a priority.
Exactly. And when we talk about it more openly, we can help to destigmatize these conditions, encourage people to seek help if they need it.
I agree. And it's not just about individual actions. There's also a role for, policy changes and public health initiatives, things that promote vascular health on a broader level.
Right, like making sure everyone has access to healthy foods and safe places to exercise, and supporting research that leads to better treatments and prevention strategies.
Exactly. It's a team effort. Healthcare providers, policymakers, communities, all working together.
To create a world where vascular health is a top priority for everyone. I love that vision. Well, we've covered a lot of ground in this deep dive, but I hope our listeners are walking away with a sense of empowerment, knowing that they have the knowledge to take control of their vascular health.
I hope so too. It's been an amazing journey exploring this intricate system that keeps us going.
It really has. So as we wrap up this episode in the deep dive, we want to thank you for joining us on this exploration of the peripheral vascular system. We encourage you to stay curious, stay informed, and most importantly, stay healthy. We'll see you next time.